Hello, everyone. Welcome to TOC Talks. This is our podcast at the Oxford Center. I am Andrew Kistner, your host, the Director of Marketing, and today I have an awesome guest. His name is Kevin Hensley, and he has an incredible story that he's going to share with us. In addition to that, he is working with Michigan legislation and whatnot to try to get some things passed to help veterans in Michigan. So I will turn it over to him just a little bit here. Kevin, thank you very much for coming on.
Thank you so much for having me. I really appreciate it.
You bet. So the first question I have for you is, I know you have a pretty extensive story and journey, through this whole thing, and I'd like to hear a little bit about that so that everyone can figure out who you are and what you kind of been through, and what, I guess, created the passion to help others.
So I retired from the military in 2015. There were some things that were going on cognitively with me that I was having a problem with. It felt like I was trying to grab a refrigerator door, but I just could never grab the handle and pull it towards me. I called it brain fog. How ironic, because of the toxic exposure element to the burn pits in Iraq and Afghanistan, et cetera, et cetera. Speed up to...
Well, so first, you obviously were in the military.
Yes.
What years did you serve? Where did you serve?
I served 95 until 2015. I was deployed 8 times to the Middle East.
Wow.
At least half of those times were running toxic exposure burn pits, some as large as 10 acres.
Holy cow.
Where if you put 8 Ford fields together, that was the size of the burn pit. So, and that ran 24 hours a day, 7 days a week. So, unfortunately, you see the oxygen around the cannula around my nose. Yep. That's a direct reflective of constrictive bronchiolitis, which is a terminal lung disease, as a result of service and exposure to those burn pits and what they burn in those pits. So after getting out finally and retiring, luckily, retiring in 2015, we were told I just had asthma.
Of course.
I just had asthma. So we were trying to find answers. My wife and I were trying to find answers. So we went to Vanderbilt, Tennessee, where a pulmonologist there by the name of Dr. Miller in Vanderbilt, Tennessee, had diagnosed me with constrictive bronchiolitis after a lung biopsy that was really extensive. My lung collapsed. I went into tachycardia. I don't recommend a lung biopsy to anybody if they don't have to. But that's the gold standard still for diagnosing constrictive bronchiolitis.
Yep.
So I figured after that, my wife and I looked at each other and said, well, we don't like the answers, but at least we're getting somewhere besides being told we just have asthma. I figured if I inhaled it into my lungs, where else did it go? That led us to Littleton, Colorado, and a SEER scan, a SPECT scan, basically, that found out that I had toxic encephalopathy, which means 90% of my brain was deprived of oxygen at that time.
Wow.
Besides a brain wound of TBI, PTSD, et cetera, et cetera. I first started hearing about HBOT, or hyperbaric oxygen treatment, in the beginning of the 2020 timeframe. I had an opportunity to go to Tucson, Arizona, North Star Hyperbarics and North Star Neurology down there in Tucson, Arizona, through a grant for healing Arizona veterans, because the organization I was with, Burn Pit 360, was able to rent a house there. And they said, as long as we're, having some sort of residence there in Arizona, they'd be willing to treat us. So I drove 2,100 miles plus to Arizona. I figured at this point it could help with at least my cognitive function, at least trying to get my brain figured out or what have you. I went down there. The unknown is what we always fear. So, you don't know what you're getting into. You don't understand, what it's like or anything like that. After my second dive, I was able to take my first deep breath in over 16 years.
Oh, my.
And which kind of scared me a little bit because of the fact that I wasn't sure if I was going to be it catches you every time when you try to take a
Right.
deep breath. And I was able to do that, and it's not designed for the lungs per se. It's more designed
Right.
for the cognitive function portion of the, healing the brain. So that was kind of throwing me for a little loop there too. But I did 80 sessions of hyperbaric oxygen treatment um, through North Star Neurology and Hyperbarics. I did a cognitive function test. I did a toxicity test where I found out that we have high concentrations of uranium, arsenic, tin, any kind of exploded ordnance, you're going to have the
Right.
uranium from. And a lot of our veterans have the uranium issues. And, again, it's the getting answers part of
Right.
this whole process. You're on this journey to find out. Now, if it was asthma, I would have been okay with that. But it's, you got to be able to validate. We put a lot of trust into our doctors, and and we're finding out that sometimes they don't have the answers, and that's okay, but that's not what we're getting kind of like these I call them wags, where they're just kind of throwing pills at you, and they're wild, what guesses.
Yep.
And so
That's like my entire story. We got Grace's, my daughter, and I know you've met her, I believe. Her diagnosis of cerebral palsy, basically out of we don't really know what's wrong. After she was, I don't know, three years old, and we walked into a new developmental delay specialist, and she said, I reviewed the file. There's no clear test that says that something's wrong, so we're just going to diagnose her with this, and do this. I 100% understand what you're saying.
Yep, and like I said, I would be better off served if they would have said, you know what, we don't know what's going on, but we're not going to stop until we find out what's going on. I think
Right.
I think they open the textbook and they try to get answers that are in the textbook if they ruled out so many options, and I understand that, but these things are, um, you know, it's important to find out what's going on with you, and you've got to be your own
Yep.
advocate. You've got to be your own piecemealing this stuff together and trying to figure out what's going on, because number one, it's for yourself, and number two, it's for your family. If something happens
Yeah.
to you, it's your legacy that you leave behind, and you want to make sure that they're not fighting for you on the back end
Right.
while grieving and all this other stuff. So we found out some answers. We went through the hyperbaric treatment. I did the right IQ test. I don't know if you're familiar with that or
Mm-hmm.
not, but
Yep.
where you look at the screen and you follow
Yep.
some things, and I scored pretty low on that, which is pretty. Every veteran doesn't score very high the first time that they go through that. At the beginning and then the end, I scored, higher, and I was feeling great. I lost about 25 pounds. I
Awesome.
got a before and after picture that would probably throw you for a loop.
We'll put it in. Send it to us. We'll put it in the podcast.
I sure will. But you know, um, I did that, and I was hooked. I was hooked on HBOT from that moment forward. The people down in Tucson, Arizona, Dr. Carol Hendricks and her staff, when you walked in there, you just felt like you belonged.
Right.
You felt like you were just part of this misfit toys that were trying to be put back together. So if you ever watch Rudolph or whatever, the old
Yes.
one, you'll see the
Yep.
misfit toys I'm referring to.
Yep.
So I'm dating myself there a little bit, but so I did that, and I said I was hooked on hyperbarics. But meanwhile, we were also advocating for toxic exposure
Right.
legislation, and I figured that if I did both at the same time, that once the toxic exposure legislation eventually passed, which it did in August 10th of 2022, when it was signed by President Biden into law, for what's called the PACT Act, and we'll go into that in a few minutes. But
Mm-hmm.
I figured once that got signed into law, or was getting closer to that point, I would really start pushing. We would really start pushing for hyperbaric oxygen treatment for veterans,
Right.
and the amount of information that we found out about hyperbaric oxygen treatment, and the veteran community and the community at large. The FDA allows for 14 conditions for hyperbaric treatment, which is
Yep.
ironically similar to what our brain wounds have, carbon monoxide for toxic exposure kind of thing, and the crush the victims, and
Yep.
and then so rollovers, rattling your brain a couple times, what have you. But there's no FDA approval for traumatic brain injury and PTSD. So, but if you talk to a neurologist, they all say if you heal the brain, you heal the body. And what do you need in life? You need two things: oxygen and water. And so with 100% medical grade oxygen at a atmospheric pressure, for those who don't know what that is, kind of like taking off in an airplane and your ears pop, or when you're going in the mountains and you're traveling in by car and you get that ear popping in your noise, that's kind of like that pressure. But if you do it for a sustained amount of time, like roughly about 53 minutes, I think it is, by the time it starts and ends with the pressure, at least 1.5 atmospheric pressure or greater, you start to heal those blood vessels, those tissues, and cognitively you start to, you start feeling better. You start getting healed, and you have memory flashbacks, and you have little things that happen during that time because the brain is healing. But eventually, you're on a better path. And I've seen so much great things happen. I've seen veterans that had come into the office there in Tucson and tell me that they were going to commit suicide 2 days before they were getting treated. And after so many dives, you wouldn't even, you'd physically recognize them, but not cognitively, you would not recognize
Yeah, not the same person.
No, not the same person at all.
Love it.
Yes. So, coming back after that, we passed the PACT Act in, like I said, in 2020. We thought we were kind of done with that, but then we started getting on board with the oversight portion of that, making sure that Congress and the VA were picking up, and they started hiring, and they started claims, and getting it ready to go. And then I figured that, well, we've got legislation in for the PACT Act, and that's kind of past the legislation part of that. Let's push the legislation piece for hyperbarics. We did a assessment in 2020 of the state of Michigan. We found out there was over 24,200 veterans in the state of Michigan that are estimated to have TBI and PTSD. So we wanted to be able to heal and treat our veterans there. The whole caveat to this, Andrew, is that suicide, not a one size fits all,
right.
Nice little box where you and I talk and we have a session, and somebody might be okay with that. Somebody might be better in a group format where they talk to other, people in a group setting. But the holistic alternatives that we're seeing now with HBOT and red light lens therapy and just all the different PEMF, or the pulse electromagnetic field, where it's helping release scar tissue and inflammation, and there's just so many different
neurofeedback therapy, there's frequency therapy, there's so many alternatives out there beyond you have PTSD, here's some pills.
Yep. Exactly. And that started the journey too. I was on 48 pills. It was like a full-time job. I swear. And my cognitive function was so bad at the beginning, I couldn't even tell you after I took a pill if I took it or not. I have one of those now. I have one of those little pill alarm things that help me remember to take pills. But, I attribute the extension of life, the quality of life, now that I have with my family. I attribute it all to HBOT. You go from the challenge is going from, when I was in the service, I was leading 200 to 400 people and running a security and law enforcement flight, basically midnight shift, graveyard shift,
Yeah.
making sure we're securing resources and running law enforcement and security operations to, not remembering if I took a pill. You know how
Right.
demoralizing that is to people, and and then all of a sudden I couldn't leave myself out of a cardboard box.
Yeah.
At that time when I started finding out these answers, and I mean, I was luckily enough to get my bachelor's degree, but as soon as I started my master's, it felt like the rug was pulled out from me, and all of a sudden I just hit a downward spiral. And so, and there's a lot of vets, talking to people and networking, and because that's what this is all about. That's what this whole world's about, is talking to people,
Yep.
networking, finding out that you're not alone. You're not riding on a buoy in the middle of the ocean waiting for that ship to come in, and where there's other people on the ship that have like some symptoms or scenarios that you do. And once we found out from SEER scan that the toxic encephalopathy, the TBI, the PTS, and et cetera, those were getting answers, and actually that provided some hope.
Right.
That's provided the hope of like, hey, if I've got this, how many other people have this? And
Yep.
and now we have this, like I said, this band of misfit toys that we're trying to put ourselves back together again, or Humpty Dumpty, or whatever you want to call it. Um, but I mean, there's,
You need some help.
yeah,
You
and
need somebody to help.
right, and other, how many people have been told the same thing? It's just asthma. This is not the problem that you are looking for. It's like the Jedi mind trick.
Yeah.
So now there's we know hundreds upon thousands of veterans who are in the same situation, and getting these answers. And now with technology, we can make these invisible wounds visible.
Yep.
And it's so great. And on top of that, now we partnered with 4D Medical to
Okay.
do lung scans to find out exactly what's going on with your lungs, similar to the color codes of the spec scans, and
Right.
finding out what's going on. So now you have a site alignment site picture of your brain. You have a site alignment site picture of your lungs. If you have, like I said, if you've been exposed to toxins, et cetera, now you have an idea where your lungs are. So because the traditional gold standard for constrictor bronchiolitis in the veteran community is now going to be diagnosed as deployment related respiratory disease. And a matter of fact, Ann Arbor is going to become a burn pit center of excellence.
Oh wow.
The VA there, and then also Vanderbilt in Tennessee is going to become a burn pit center of excellence as well. So those answers are going to continue to get, people are going to continue to get those answers. They're going to get hope. And the third thing is that we're all talking about this in solidarity.
Yep.
So that's the bigger thing, is that we're all coming together and then saying, hey, look, I have this, well, I have that, and I have this, and this is what I did, and this is what I did. And so now we're all coming together, and these scans will help the community with COPD, with emphysema. They'll give them a better site alignment, site picture of pulmonary fibrosis, of where their lungs are at their current state. And actually, it'll tell you now, well, your left lung and your lower lobe or your upper lobe is doing better or worse than your right
Right.
lobe. So it gives you that area, instead of saying, oh, your lungs are just shot. Now it gives you that, that site alignment, site picture of where they are and what's going on. So those are
So
positive things in the community.
So I know that when we met, I don't know, maybe a year ago, you were trying to get legislation passed so that the VA would pay for some of these services like hyperbarics or neurofeedback or whatever, the scans and things like that. Where are you at in the state of Michigan with that process?
Right now we had a resolution done by Julie Rogers like a year or so ago. That resolution had bipartisan support. They had 8 Republicans and I think 12 Democrats on board with that, because I don't look at it as a red or blue issue. I look at it as a red, white, and blue issue. So
yep.
now, matter of fact, as of yesterday at noon, there is a draft for legislation from House Representative in the state, Kathy Schmaltz's office. We are reviewing that draft as we speak to find out, what we can put together for legislation. So we are very excited about that.
Love it.
But currently, there is 10 states that have signed on for legislation, and there's 6 states that are in the process of legislation, and Michigan is one of those 6 states that are pending
Awesome.
State legislation.
Awesome. So they're going to be able to help fund directly veterans through whichever, clinic in Michigan that they need. There's not that many hyperbaric oxygen therapy clinics. I think we're probably the largest in the state of Michigan. But there are others, and every clinic's a little bit different. Some only treat those insurance covered conditions. We treat upwards of 100 different medical conditions. So what you're trying to do is to get funding from the VA that will go to those veterans for those services. Is that correct?
Well, what's going to happen with this legislation directly is that the actual medical doctor, if they feel that the person needs the treatment for HBOT, they can fill out a grant. The doctor will request the grant
Awesome.
for that person to go, and it's kind of like writing a script.
Yeah.
You want to make sure that your I's are dotted and your T's are crossed, and you're not sending somebody who could not benefit from HBOT from the treatment. If they have an inner ear problem or something like that, HBOT's not the tool for them to utilize because that'll do more damage than it would with the pressure than it would help. So basically,
in most clinics, like here, we have to. Everyone that dives through HBOT has to go through a clearance board. Of people that are certified in hyperbaric medicine and whatnot. I would assume other clinics have that. I hope they have that. But a lot of times we find that doctors have no idea. They have no clue when it comes to treating any condition with hyperbarics. They know the 14 maybe, but very seldom do they know enough about hyperbarics to recommend that treatment.
And it's unfortunate because they don't understand it, and a lot of treatment places are insurance based, where the insurance will allow you to do this, and then that stops, and then they stop. So hopefully this will go through. We're taking some time to review the legislation. I think it's like 4 or 5 pages on the bill. We'll have it in by the end of this week, and then next week they'll be pushing it through for legislation. But it doesn't stop there. We also have federal legislation that just came out. Representative Biggs from Arizona put in a hyperbaric oxygen for veterans with TBI and PTSD in the federal side. And now Greg Murphy from North Carolina just put in another bill. I don't have the bill number for that yet, but, so it's working on the federal side and the state side because, people need to get treated. You just can't wait for a bill and hope, because there's several processes to it. It's got to go through the House. It's got to go through the Senate. It's got to be signed by the president or the governor, depending on if you're on state or you're on federal. So meanwhile, these people need to be treated or are having issues. They need to be taken care of. And that's what we need to be pushing along those lines as well.
Awesome. So I think then, I guess my big question is, so let's say all this works out the way that we want it to work out from a legislative standpoint. The money's there, the grants are there. There's obviously tons of veterans, so the need is there. How do we get doctors aware of what we can do, aware of the treatment so that they prescribe the treatment, because we can pass everything we want, but if no one knows it's there, how do we is that through veterans? How do we get them trained?
So what's going to happen is we got to work with our legislators. We have to put this out. I would like the clinics that actually operate with hyperbarics to be the lead vocal on that, to say, hey, look, if you have a veteran and they're showing signs of cognitive function issues or, whatever the case may be for PTSD or TBI, that should be the automatic next step should be, let's get them into an HBOT clinic and let's get them into, so they have to understand that. It's going to be an oversight and education piece to that. So, like you said, it's going to be crawl, walk, run theory. But once the legislation gets to the point where it's going to go to the governor's desk, I think we need to interact and say,
Right.
hey, look, what in the medical field can we push to show people? Because right now, and I know we're running out of time, but diabetic foot ulcers,
Yes.
they're amputating more people with diabetic foot ulcers than they are treating them, and they're not even given the opportunity to talk about HBOT. So
Right.
we're failing on that. And diabetic
Yeah.
foot wounds are an FDA approved.
Right. But it has to be a number 3 on the, I don't know, the Wagner scale. If we can treat it when it's level 1, we can save everything. But yeah, they wait right before we have to amputate. Okay, let's try our last resort. It's like, well, no, let's do this first, and then we don't have to get down to that point. So I think from a marketing perspective, I'm obviously a marketing guy. It's got to go through the veterans. The veterans, we have to market to veterans, saying that this is an option. This is a treatment and a therapy that you can get help from. You have to talk to your doctor about it.
Right. And that's where I think we need to contact the veteran service organizations,
Yeah.
and let them know the education piece. But as of right now, all of the chartered veteran service organizations have hyperbaric oxygen treatment as their second priority for legislation for this year. So we're
Awesome.
talking American Legion, VFW,
Right.
DAV, VVA, the Vietnam Veterans of America, MOA, Jewish war veterans, Catholic war veterans, you name it, the gamut of we're on the congressional charter, aspect of that. We've all come together in a commanders group. We have over 550 plus thousand veterans here in the state of Michigan. We are the 11th populated state by the veterans
Wow.
community in the nation. So we have to be able to show folks, tell folks they have to use their 5 senses: see, touch, taste, smell, the whole 9 yards, to be able to get this out. And then it comes down to, okay, our legislators going around to their constituents and saying, there's hope for you for TBI and PTSD,
Yep.
proven hope that's safe, effective, doesn't do any harm. That the doctor's creed of do no harm. There's no needles, no surgery, and stuff like that.
Right.
And let's give this a try and see what happens. And I'm telling you, testimonials are huge.
Yep.
So yeah, so there's a lot of opportunity there that we need to continue. Just because legislation passed, we're not done.
Right. Awesome. Well, we are here at the Oxford Center for you and all the veterans. We are more than happy to do anything that you need us to do. We have marketing budgets and whatnot that we have the ability to help with this. So let me know what you need, and we'll see if we can help as many wonderful, awesome people as possible.
That's great, and I really appreciate the time and the opportunity to join you today on your podcast.
You bet. Awesome. Well, thank you very much for coming, and we'll probably do when you have an update to give, let me know. I'll get you back on, and we'll talk some more.
Sounds good. Thank you so much. Have a wonderful day.
All right, everyone. Thank you so much for joining us for this episode. Kevin is an absolutely amazing individual. We sat down maybe a year ago when he had just treated and changed his life, and he wanted to take this to another level to help as many veterans as possible. Veterans mean a lot to me personally. They mean a lot to the Oxford Center, and we're going to do everything we can to help him through this process, to get all this legislation passed, to get the awareness out there, get the doctors on the same page, and do whatever we can to help these veterans. So thank you for joining us. Please like and subscribe and share our videos and our podcasts with friends, family, and everyone on the internet. I'm having a blast doing this. So we will see you guys next week.